My first recognition that the environment has deep and profound influences on people's health was when I arrived in medical school at the age of 22. And I went to medical school in Baltimore and first saw East Baltimore and was being driven around by an upperclassman and was in shock. I said to the driver, I said, "When was there a war here?" Well, I started working at the medical school and started to see patients from this community. I realized that I was trying to treat social ills with pills. And the issues that people were bringing to me had nothing to do with medicine. They had to do with a lack of core resources, health resources, access to healthy food, access to employment, access to opportunity. And here I was looking for the pill to give them to treat the manifestation of this great social deprivation. You need different kind of people working on public health than you used to. It's not just doctors and nurses and the like anymore. You need to actually bring in people who understand other aspects and other domains of society, like, for instance, how the built environment contributes to health. Where you live matters, and it matters a lot. Another way of putting this is, does your zip code matter more than your genetic code? This is Baltimore, Maryland, where they have a census tract down near the Inner Harbor with a life expectancy of 62 years, and another life expectancy up in northern Baltimore, 82 years, a 20-year life expectancy difference. This is Cuyahoga County, Cleveland, where we thus far have found the greatest disparity in life expectancy. This is Huff, an inner city neighborhood with the average life expectancy of 64 years, and 8 miles down the road is Lyndhurst, with a life expectancy of close to 90 years. The rates of chronic disease are much higher in low-income communities. Being poor doesn't just mean that you don't have enough money. It means that you are also going to be exposed to a whole host of influences and forces that we know are bad for your health. We think of public health as being about social justice. There are two core elements. One is truth, and the other is power. And what we've been good at in public health is speaking the truth. What we haven't done well in public health is talk about power and talk about why this truth is the reality that we have to contend with. And until we talk about the underlying power that creates this truth, we're not dealing in social justice. So we've actually hired community organizers we've dropped into these communities and said, just build power. We want to see an increase in social, political, and economic power, because ultimately those are the levers of change of the environment.